As the H1N1 flu virus is in full force around the world, the Chinese Ministry of Health has issued treatment guidelines to traditional Chinese medicine doctors. The good news is that many of these herbal medicines can be found at your local TCM clinic. These medicines can be very effective in the treatment and prevention of the H1N1 flu virus. For that matter, they can be effective for the common seasonal flu as well. And if you are one of the many people who are reluctant to get the H1N1 flu vaccine, TCM herbal medicine can be a viable alternative. It is strongly recommended that you see a TCM practitioner for an examination and diagnosis. He or she will then prescribe an appropriate herbal prescription. A recent study in the May 2009 issue of Annals of Nuclear Medicine reports that acupuncture relieves symptoms, improves physical function, and improves quality of life in rheumatoid arthritis patients, but appears to have no or limited anti-inflammatory effect. Japanese scientists use positron emission tomography to investigate uptake of a radioactive dye into the joints of rheumatoid arthritis patients undergoing acupuncture treatment. 6 patients received 10 acupuncture treatments over a 2-month period. At acupuncture points around the knee joint, pain, knee joint range of motion, patient mood, and daily lifestyle activity improved significantly after acupuncture. However, regional inflammation was not improved. People who are prone to anxiety are more likely to develop asthma, according to German researchers. The team used a questionnaire to evaluate tendencies to hysteria, anxiety, and depression in 4,010 adults without asthma. When they reassessed participants 9 years later, they found that those who had high levels of neuroses were 3 times as likely to have developed asthma as those with low test scores. Animal studies have previously shown that chronic stress alters hormone levels, which can lead to airway inflammation, reported in February 2009 issue of Allergy. A team of American scientists have reported that regions of the brain involved in emotional regulation are larger in long-term meditators than in non-meditators. The group used high-resolution magnetic resonance imaging, or MRI, to scan the brains of 22 participants, all of whom had extensively practiced meditation. They were compared with age-matched control group. The MRI showed that regular practice of meditation is associated with significantly larger volumes of the right hippocampus, right orbital frontal cortex, right thalamus, and other regions important in emotional regulation and response. This in the 2009 January Neuroimage publication. Coming up next, our practice segment on auricular acupuncture. That's ear acupuncture. But first this.